Hi, Donna. How can I help you? Good morning. We want to welcome you to our Community Impact Training Series today for 2019. My name is Dr. Joanna Mitchell Brown. I am the CEO of Joanna Mitchell Brown and Associates, which is a community research and market analysis firm here in Indianapolis, as well as the founder of Civitas Institute for Community Impact, which is our research training arm of JMBA. And beyond that, I'm a senior research fellow with the Sagamore Institute, which is a public policy think tank, which seeks to turn action into impact through public policy analysis, building better citizens, as well as advancing public policy solutions. We are hosting today's webinar in conjunction with Prosperity Indiana. Prosperity Indiana is a statewide organization for public, private, and nonprofit organizations, and they provide resources as well as opportunities for engagement, advocacy, and programs for those different sectors in hopes to build capacity and allow them to lead change in their communities. And so today's webinar, as well as future webinars, will be hands-on and interactive. We try to make them as interactive as possible so we can have these training resources that will really be a guidance for you guys in terms of strategies that will help you educate and provide change and innovative solutions in your communities. And so our goal is really to elevate community well-being across Indiana as well as America. And so our host today is the Lutheran Foundation. We're very happy to have this partnership today with the Lutheran Foundation, and they will actually lead the webinar today on LookUp Indiana, which is an initiative stemmed around mental health information and reducing the stigma surrounded around mental health and mental health needs. So for today, in terms of the agenda, I just went over the overview of who we are and what we're trying to do with this Community Impact series this year. But I also want to go over some upcoming webinars and registration, as well as accessing course materials for today and for the future. And then we will get into the lookupindiana.org webinar series. Just for a side note, everyone is muted. However, if you have any questions, please feel free to type in your questions in the chat box at any time throughout the webinar. And our panelist who will be leading the training today, Heather Huntley, will actually respond, and we will respond accordingly. So we have a series of 22 webinars for the entire year, but for March and April, we actually have a couple of webinars that are coming up. So on March 8th, we have our Collective Impact 5 Components, which is an introductory course on collective impact and the process. On March 15th, we have Are Your Volunteers Helping or Hurting Your Organizational Capacity? And then on the 22nd, we have Using Transactional Resources to Be Transformational. And then moving into April, we have 2 additional webinars, which are Tips and Techniques for Competitive Pitches for Grants, and then Strategic Board Building. Again, all of these are interactive and hands-on webinars. Those that are in orange are actually our free webinars. Those that are in black, there's a minimum fee for registration, and we will send those links out to you later on this afternoon to begin to register. In the future, you'll be able to go to Prosperity Indiana website /events to register for any of these webinars, but you can also go to our Civitas Impact website, which will then take you to the Prosperity Indiana Impact Events website to register. On the Civitas Impact, in the future, we'll actually have our course content. So later on today, we'll actually have the training material will be uploaded to the website for you to access. And then as you begin to register for some of the upcoming training sessions, you'll be able to download that course content either before or after, as well as to review the webinar videos in the future. And so we'll send out a link to that when we send out the course evaluation later on this afternoon to register for some of those courses, as well as to these additional links. You should have received from me today also a course tutorial via email. If you haven't, just shoot me a quick Q&A and I'll try to email that to you if you didn't receive it yet. But you should have received it. This will help you go through the course exercises today as Heather goes through the webinar training series, or session, excuse me. And with that, I would like to introduce our trainer for today. We're excited to have her. Her name is Heather Huntley. Heather is passionate about helping connect people with resources that they need for better mental health. She is the project coordinator of the Lutheran Foundation, and she manages the LookUpIndiana.org website. She has a BA in criminal justice and sociology from Indiana University and is very active in the community. She currently serves as the president of WildNet Fort Wayne, a women's philanthropic networking group. And so with that, I would like to turn it over to Heather.
Good morning, everybody. This is Heather. Happy Friday. And if I'm doing this correctly, you should be seeing my screen. Okay. So again, I'm Heather Hunley. Thanks so much for spending a little bit of your Friday morning with me. I'm excited to share some of what I've been investing my time in for the last about 2 years with LookUp. And I love doing this work and helping people find resources for better mental health. So as we go through the presentation, again, feel free to type your comments or your questions in the chat box, and I'll kind of respond to those as we go. And our agenda this morning, as far as my presentation, is to just go over a brief history of how LookUp came to be, and then we'll walk through the main sections of the site and give you time after each section to do like a short practice exercise on your own and ask questions before we move on. Okay, so before we dive into how you might use LookUp, I want to give you just a really brief background. So the Lutheran Foundation, which is the funder and the founder of LookUpIndiana.org, we're a nonprofit foundation in Northeast Indiana. We serve 10 counties in Northeast Indiana, and we've been around since about 1995. And we invest in our community mainly through grant making. And so back in 2012, we were looking for the gaps in service. What were the things that we were making a difference in funding, and what were those things that were still kind of an unmet need in the community? And at that time, my role was a little bit different here at the foundation, and I did a lot of research. And so I started looking at our 10 county service area and where all of the foundations and the nonprofits were investing their money, what kind of categories what was the funding going to. And so there were things, like youth and families, and there was health, for people that were uninsured or underinsured, and lots of great things going on. But one thing that was perhaps not surprising to us now, but at the time it kind of seemed like a wow, was that less than 1% of the total grant dollars in Northeast Indiana from the previous, I believe it was a 5-year period that we looked at, was going really kind of directly towards mental health or mental health funding. And so that seemed like an obvious gap. And we thought, okay, so we know where the gap is, what do we do now? And you might not be surprised to hear that our board thought, okay, we need to do, a study, an assessment to actually see where are we at? What does that mean? And so in 2013, we did a really comprehensive mental and behavioral health needs assessment for our 10 counties, and that took about a year to complete. And the results of that assessment, which are a little dated now since it was in 2014, but you can access that on the website, and I'll show you how to do that here in a bit if you're interested. The results showed that, not surprisingly, people don't know where to go for mental health help. And there's a stigma associated with even talking about needing help, let alone where to go to get the help. So in response to this assessment, what do we do about that? And one of our ways to address it was the development of this, what we like to call one-stop shop for mental health, or what I like to refer to as a starting point. Where can you go first for mental health help? And that was a website. Most people have access nowadays to the internet and to a website. And that website was LookUpIndiana.org. And we were launched in February of 2016. And I say regional website in that we have a provider directory, which we're going to walk through on how to use that. And at that time, we only had providers, mental behavioral health providers, listed for our 10 counties here in Northeast Indiana. And, we quickly got requests for, hey, what about, the rest of Indiana? And so in 2017, we were able to get some partnerships and some more manpower and some lists from insurance groups and things like that. And we were able to expand that provider directory to be statewide. So we now have mental behavioral health providers listed for all 92 counties in Indiana. Some counties are weaker than others as far as the information that we've received, and that's something that we are continually working on, and you all can be a part of that if you're representing kind of counties that have not a great representation in our directory. And then last year in 2018 was a really big year for us. We partnered with the Indiana System of Care on a My Community page, which we'll walk through that, and also with the Indiana School of Disability and Community down at IU for their Indiana School Mental Health Initiative. And their website and that initiative is also hosted and housed on LookUp, which has been a great resource for our community and an exciting partnership. And now that leaves us to kind of jumping into the site itself. So you might notice right now I'm showing you screenshots only because it was a little bit easier for me to organize how I wanted to show you the information, but we'll be toggling back and forth between the live site, and then I'm actually going to give you a chance to hop on the live site and make sure that you can navigate it and that it's working for you. So this is our main page, what you see when you hop on to lookupindiana.org. And, we really want to remind people that mental and behavioral health issues can be a silent struggle, but there's hope on the horizon and you're not alone. So hope is one of our key words. And you might hopefully know, or it might not be surprising to you that, 1 in 5 of us will struggle with a mental health condition at any given time, and 1 in 2 in our lifetime. So if you don't need this website, likely someone close to you does or could. So crisis connectivity, we have 3 crisis line options. They're all available 24/7, 365, and the text to chat, or that started chat that's circled there, that will connect you. The average wait time, the length of time clients had to wait for a response from the crisis team since we launched in 2016 was 1 minute 42 seconds. Which we're pretty proud of. So that's the average time. So a lot of those wait times are shorter. And we've had just over 25,000 conversations with the text and web chat since we launched in 2016. And about 14,000 of those were considered to be meaningful conversations, which meant that, it was a longer chat, an actual conversation, not just somebody, checking out to see if there was someone on the other end listening. And then that 800 number, actually that's a partnership that we currently have with Parkview Behavioral Health, and they serve Northern Indiana. However, if someone outside of the region calls that number, they're able to refer out to a community mental health center in whatever county or region the person would be calling from. So while we're talking about the crisis connectivity, I wanted to just point out, this isn't in your slides that you were emailed out this morning. I added it kind of last minute because I thought, I wanted you all to know that you can request what we call crisis cards. They're the size of a business card. They fit great in your wallet, and we give these out by the thousands. They're especially great to give to youth in your life, to encourage them that it's okay to talk about their struggles, even their secret ones. And so, it says your pain is real, so are we. You can chat with a real person. We're here to help whatever you're facing. And if you want these to hand out at your business, your church, any group, I'll show you how to request those on the contact page later on, and we can mail those all over the state. If you live in the area, can drop them off. You can pick them up at our office. We really want to just get those in the hands of anybody that needs a reminder that there's always somebody to talk to. Okay, so beyond having this crisis number to text, LookUp wanted to address where to go for help from a standpoint of what organizations are close to you that offer mental health help. So this is our Find Help directory, and when you're in LookUp and you click on Find Help, which we have circled up there, it lists mental behavioral health providers for every county in Indiana, as I said, and it's ever expanding and by no means perfect or complete, but it's continually updated as we get new information, and I'm going to show you how you can help here in a minute. But the easiest way to do a search would be to enter your city or your zip code, and results are filtered by the providers and resources listed closest to you. And if you're looking for information on a specific provider, like let's say you want to, your XYZ counseling company and you want to see if you're listed, you could literally search by your name. But if you don't know who you're looking for, then you'll want to search by city or zip code, or you can even type a county name. And you'll want to be sure that you follow the directions just above the search bar. Essentially, you need to enter in your full city name, your city and your county, and then wait for Google Maps to kind of find a match, and then you'd click on that match before clicking Find Help. Okay, so I clicked on Find Help for Fort Wayne, Indiana, and you'll see we have all of these search results here on the left-hand side, and you can view your results several different ways. So here I've narrowed it down to residential or inpatient mental health providers, and I wanted ones that specifically accepted youth. So let's say we're interested in this Crossroad Child and Family Services. And here it gives me a little description, it tells me directions, and I can also click on this record to actually view more. So here I'm viewing that particular record, and it's giving me all the information that we have in our database for this record, including their website. This one even has their hours served, the ages served, where the location is, and so forth. So since contact information changes all the time, as providers change locations, services, other offerings, we've added this suggest and edit feature. So it's kind of like a claim your listing, and you'll see at the bottom of the map on every record, I have it circled there with an arrow. It's kind of tiny if you're on the live site and you don't know to look for it. And if you have updates to the information on that provider, or that provider is you, or you've been a patient and you know some information that would be helpful, anyone can suggest and edit. It will ask for your name and email, and then it'll allow you to make suggested changes. Be sure to save it, and then it will come through to a LookUp administrator for verification and approval, and it will be updated if it's verified to be an accurate edit. So that's something that is really helpful to us to keep things updated. So be aware that that is an option. So going back to the search results, one thing I like to point out is just, again, all these options that you have within your results. And not only are there listings for what you might consider your typical mental health provider, but there are also recovery residences, or what you might think of as a halfway house, shelters, social service organizations, state and local resources that have a mental or behavioral health component, and support groups. So each of these categories has some filtering options within it. For instance, I clicked on support groups, and you can filter them, by addictions, eating disorders, and so on. And so this is probably one of the areas that would be weaker, I think, in counties that are outside of northern Indiana, only because support groups are kind of organic, and a lot of times they pop up and maybe they don't have an official website that we can find out about. And so it's really more word of mouth or organizations that run those, letting us know to get those listed. And you can do that on our Contact Us page, and I'll show you that in a minute. So I see a question in here. Jessica, thank you for asking. She said, so sorry, my sound cut out when we were talking about the business cards we can hand out for help. Where can I find these? Great question. And actually, I'm going to show you towards the end. We have a Contact Us page, and you're able to request the crisis cards, as well as brochures and posters and all of that right in there. And you can enter your mailing address, and we'll get that taken care of. So just stay tuned, and we will get that answered. Yeah, you're welcome. Okay, so let's take a couple of minutes and let you explore just a little bit of what you've just learned. So I'd like you to go to our website. Again, it's lookupindiana.org, and click on Find Help. And I want you to practice entering your city to make sure that you're getting, you know, again, your city name, your state, your country, so that you can give Google the right match to pull your best results. And then see if you can complete these exercises. And just so that I feel like I'm not alone on the end of this call, type a comment or a question in to let me know that you've completed it, and or if you have any questions. So we'll go ahead and let you open a new screen or minimize, open up our website, and try these exercises. So go ahead and keep working through your exercises. I want to respond to a question that has come through on the Q&A from Heidi. My question is there a way for families and providers to look up providers to help families starting the process and follow up with gaining the Medicaid waiver, and also searching for Fort Wayne residential placements for individuals post 18 years old? So the first answer would be, as far as LookUp having resources to help follow up with gaining the Medicaid waiver, that is not something that LookUp has. You know, as we all know, insurance is so complicated. And so even as far as the providers that we list, when we list the types of insurance they offer, we know that we're kind of weak as far as it's very narrow. We say they either accept Medicaid, Medicare, or they have private insurance or a sliding scale. And, you know, beyond that, because that changes so often, it's always important to, you know, call that provider to verify those things. And then we should be able, we do list residential placements for individuals after 18 years old, if there are any. You would just search for residential or inpatient mental health providers, and then you would not select the for youth option, and that should give you results. If you're not finding what you're looking for, feel free to contact me, and I can put you in touch with some people, system of care in our area, and really kind of help you navigate that further. Hopefully that answers your question, Heidi. Great, you're welcome. Heather, I'm glad that you found it friendly to use. We're trying to make it a great user experience, you know, bright, friendly colors, not intimidating. So that's great to hear. Rashonda, thank you for letting me know you completed the exercise. Great job. Leon, yeah, thank you. That certified recovery residences is something that we added, I think last summer, we decided to add that as an option. And that's actually a great point. If there are options that are missing here, you know, contact me. I have my email at the end that we'll talk about, or you can contact me anytime through the Contact Us page. And that's the great thing about this resource. It's for Indiana, it's for all of us. So if there's not something that you need, you know, let us know and we'll do our best to work through that. Great job, Jessica. I'm glad that you like the support groups. Cheryl asked, do you know of anyone who can help with people with extreme hoarding disorder? That's a great question. My assumption would be that there are therapists that would handle that situation. I know that we don't have that particular scenario listed as an option for a specialty. That would be something, though, a question that we could reach out to. I don't know what area you're from, Cheryl, or Cheryl. I apologize if I'm saying your name wrong. A system of care that. Okay, we're going to take maybe one more minute or just a few more seconds, and we'll move on. Okay, Cheryl, Adams and Jay County or even Allen County. I'm going to make a note of your question. And I'll put a feeler out with our Allen County system of care and see what we get back for you. I should be able to have your email from the registration so we can touch base. Making myself a note. Okay, Catherine, how do you suggest an edit? Let me go back to, actually, let me hop over to the live site. And show you that okay, so we're in the live site, we're clicking on Find Help. We're typing in our city. We were just talking about support groups, so let's just say that we want to make an edit to this particular support group. Underneath your map is the Suggest an Edit. Now, when you click on that, yours is going to look a little bit different than mine. Yours should ask you for your email and your phone number, or your email and your name. I'm logged in on the back end, so I don't have to do that, but you click Suggest an Edit, enter in your name and your email, and then you have all these little pencils. So let's say these hours of operations were wrong. You'd click your pencil. You'd enter in what the correct operation hours were, you know, Wednesday at 5 or whatever it is. And then you would click this little Save Disk. it'll tell you it was saved and submitted for review, and it's as simple as that. Then you can close your editing. And you can do that pencil mark for any of these. Does that answer your question? You're welcome. So Jessica, you noticed a few websites do not link correctly. Yeah, you can actually suggest that yourself or fix it under, with the suggesting an edit. That would be the easiest way to let me know. If you don't feel comfortable with that, then, certainly, yeah, let me know. You can email me and we'll get those fixed. Thank you. Are there any other questions on the Find Help section or things that you're struggling with? Okay, let's move on. But if something else comes up, just pop it in the Q&A, the chat box, and I will come back to it. Okay. Oh, a few more questions coming in. Let's see. As I reviewed the residential placements, I'm putting together a question about long-term residential placement for chronic mental health issues. Okay. And another person, how are the resources sorted geographically? I noticed that there are agencies coming up in Indy for a 46805 zip. Am I doing something wrong? Okay, great question. Yes. Let's answer the zip code question, and then Heidi, I might need to get back with you. Okay, great. So let me go back to the live site, and we're going to work on the zip code. Okay. So we go to Find Help, search by city or zip code. So if I type in 46805, if I just click Find Help right now with typing in 46805 and I don't click on this match down here that says Fort Wayne, Indiana, 46805 USA, if I don't click on that and I just click Find Help, and this is all Google based, and it's probably the trickiest part of our website, and we've tried to make it as clear as possible, but it's really still a common mistake. You can see it's showing me results all over Indiana, but if I go back in and I type in my 46.
I'm jumping in because we can't see your screen. You have to share with us.
Oh.
We see the PowerPoint presentation.
Okay.
Thank you.
Thank you. All right, I apologize, everybody. I didn't press the button that said share. Ha! Okay, so hopefully you're all seeing Find Help now. All right, 46805, we typed in 46805. And if I just click on Find Help now, and I don't click on this match where it says Fort Wayne, Indiana, 46805, and I just click on just my zip code, it shows me results all over Indiana. Now, if I go back and I type it in and I let Google kind of catch up and be really specific and exact, like Google Maps likes to be, and click on that full Fort Wayne, Indiana with the zip code and then click Find Help, now I'm going to get my accurate results for 46805. Does that make sense? Okay, Cheryl, thank you for pointing out that website. I will get that updated. Okay. If I missed your question, Heidi, I'm going to get back to you. That might be an offline conversation. We're going to update the United Way website. Thank you. Or you can suggest an edit and update it. That would be great. Okay, keep them coming. We're going to move on. Okay, you should be seeing my PowerPoint again. And we're going to move on to what LookUp has to offer beyond this Find Help directory. So beyond where to go to find help from a provider standpoint, what about where to go from like a research standpoint? You know, when you ask Dr. Google something and you get all kinds of results back, it can be scary and difficult to know, you know, what sites to trust when you kind of blindly Google a topic. And so again, as part of that one-stop shop mentality, beyond, you know, providing a crisis line for where to go to help, to literally connect you with the providers who can help you further, we wanted to provide you with that one-stop shop of where to kind of start to get information. Because a lot of times, you know, think about buying a car, you don't just go buy the car. You don't just maybe go to the therapist. You want to look up first and think, well, I might be struggling with anxiety or depression or a substance use disorder, but I want to know more, you know, about that before I just go into a provider. I don't even know what kind of provider I need or what I would say when I go there. And so that's what Topics is really kind of all about. So when you click on Topics, you can navigate a couple different ways. You can navigate by conditions and substances, or conditions and diagnoses, or by types of drugs and substances. And we're currently working on another section that'll be called therapies, and it will list types of therapy, you know, so what is CBT, what is EMDR, what is RRT, all of these letters and things, what does all of that mean? And it'll have things to consider when choosing a therapist, how to prepare for your appointment, that sort of information. And if that interests you and you join our mailing list, which I'll show you how to do that here shortly as well, we'll let you know when that new section of therapies is live and ready. But so for now, I want to show you kind of what you could expect if you click on conditions and diagnoses. So here's a list of what's currently listed there, and we add to this over time. And just keep in mind that LookUp is a website for mental and behavioral health topics. And so we're not listing topics that are kind of outside of that spectrum. And there are some that are kind of, you know, shades of gray. Like a lot of times I'll get a question about if we list autism, and we do not, even though there is a high correlation of, you know, autism with a co-occurring mental health disorder. But there's actually, we're working on a partnership with the disabilities website that'll be, we'll be linking to their information on autism, and they'll be linking to our information on mental health, because we really want the information that we have to be more focused on, you know, purely mental behavioral health. So here's an example of what you can find on a topic page. There's articles, videos, and some facts or, you know, talking points. And then we've recently added a screening tool for each condition and diagnosis. And our content comes from a variety of sources. Some of it is original content that's been written for LookUp by experts in their field. And much of what we have is from other reputable sites and sources that we've vetted and we've gotten permission to use. So you would just toggle between, if you're looking for an article, a video, some quick talking points, or again, this screening tool. So here's the screening tool for depression. And these tools are meant to be easy to understand questionnaires that can be printed out, completed, and then ideally taken to a doctor to discuss. And so one thing that we found out was, taking the results of a screening that you took to your appointment might be an easier way for you to start the conversation. It gives you a starting point, hey, I took this screening, I wanted to see what you thought about my results, versus kind of the fear and the stigma of going in and saying, I think I might be depressed. And so each screening tool looks a little different depending on what condition or diagnosis you're on. But again, they're all downloadable, I think with the exception of one, which takes you to a site to do the screening on a site. And then you would print out your results to help you start that conversation. So going back to topics, here is what you could find when you click on alcohol, tobacco, and other drugs. And this is a great place to start if you are curious about, I've heard about this opioid epidemic, but I don't really understand what an opioid is. Or we just added this page on tobacco recently. There's a lot of news, about vaping and juuling, and you're hearing advertisements on it. And so, what information can you trust that's just the facts and that isn't kind of taking a political viewpoint? Okay, so more time for you to explore topics. So again, let's go to the live site, lookupindiana.org, click on topics. It's right next to where Find Help was. And here's a couple of exercises for you to try out. I really want you to be comfortable with finding the screening, to know how to find that screening, and then just maybe explore a few topics. So if you want to do these exercises, it kind of gives you a structured activity you can do or just explore. And then just shoot me a comment in the chat box to let me know that you're done, or if you have any questions or comments. So hopefully you're all finding what you're looking for. I'm going to hop on the live site and just walk you through quickly where you would find the answers to those exercises in case you weren't able to find those. So hopefully you're seeing the live site. Find the screening for substance use disorder. So we're going to go to topics. We're going to go to conditions and diagnoses. We're going to navigate to substance use disorder, click on it, and click on our screening tool. And the screening tool for substance use disorder that we use is this CAGE substance abuse screening tool. And when you click on that, it's this PDF here. The next exercise B was find the screening for anxiety. So that will work the same way. We go to topics, conditions and diagnoses, click on anxiety. Come down here to our screening tool, click on screening tool, and here is the generalized anxiety disorder questionnaire, sometimes referred to as the GAD-7, and that would be there. Exercise C, find an article on bath salts. Where did you find it? So topics, bath salts would be a type of drug. It's actually considered a synthetic drug. And here I'm in articles, and here is the article on bath salts. So when you click on read more, there's your article there. And at the end of every article, if you click on read more, it will take you to the source of where we got that information. And lastly, exercise D, find a video explaining the difference between smoking and juuling or an e-cigarette. Where did you find it? Well, if we're thinking about smoking, we think about tobacco, which is a type of alcohol, tobacco, or other drugs. We'll click on tobacco. It says find a video, so we know it must be a video. There's our videos, and smoking versus juuling. Short animated video explains the similarities and differences between juuling, e-cigarettes, vaping, and smoking. And so these are all embedded videos that you can watch right here in the site. Are there any questions or comments before we move on? Okay. We were quiet on that one. So you should all be seeing my presentation again with communities. So the communities page is very similar to the topics page in many ways, except that now we're talking about, kind of communities of people. So parents, students, faith community, maybe you have some mental health concerns and you want to know about those kind of from a faith perspective, or you're worried about your kids and you need specific parenting tips on how to address those issues. You're an employee or an employer and you have some strife in the workplace. And then we have the for students and then the my community. So we'll walk through those. So here's an example of the For Parents page. You'll see it looks really similar to what we just looked at. We have articles, videos, and talking points. You'll notice there isn't a screening tool for that section. These aren't conditions or diagnoses, these are groups of people. So if you're a parent, you don't need a screening tool for that. We have a student page. And this is a pretty complex page, and if you're going to hand out those crisis cards to any youth in your life and you have a moment to kind of share with them something about LookUp, I would encourage them to come to this page for students. And I'm going to share with you the video just because it's a great short video. It's under 2 minutes. And you have the opportunity to play it for yourself later or play it for someone in your life. When you click on the students page, it's this video. So we're going to watch that now. Okay, so I'm going to go to communities. You should be seeing the live site, and go to students. And we're going to play this video.
Look around you. Even when you can't see it, everyone hurts. Sometimes the pain is because of a mental, behavioral, or emotional health issue. But when someone is suffering, they don't look the way you'd expect. They don't look crazy. They don't look sad. And they don't always look for help. Whether you need to find help or help someone else, there's hope on the horizon. It's time to look beyond the labels. It's time to look up. To start the conversation and silence the stigma, go to lookupindiana.org. To talk to someone now, text LOOKUP to 494949.
Okay, so there's an adult version of that video as well that is found on there's a link to that on the homepage. And so it's adults kind of with the adult, issues. Here are some of the student topics. So these look similar to the other topics that we saw, with the exception of there are a few things like bullying and self-harm that were not included in the other topics. And then these pages, again, they include your articles, videos, and talking points. They do not include the screening tools because most of those are really geared more towards adults, or you'd want an adult helping you kind of navigate that. But a lot of these articles, videos, and talking points are written in more of a youth language, and a lot of the videos would feature, their peers. And so it's a little bit targeted towards students. And when I say students, I'm referring to really middle school and high school. This isn't really college focused, which, at that point you're kind of looking at adults. The last part of the Communities tab that I want to share with you is this My Community section. And this is where we talk about our partnership with System of Care. So if you click on the My Community tab, you're going to see this map of Indiana, and you are able to literally click on your county or select it from a drop-down or type in your zip code. So if I click on Allen County, I'm going to see information up here in the header about Allen County's system of care. And their system of care is called Our Children, Our Future. Here is the name of the coordinator and how to get a hold of her. And each system of care page, they have their own news, which is kind of like, I like to think of like a blog. They have resources, which I'll show you next, and then they have their own county event calendar. So Cheryl, you were looking for somebody that could help someone with an extreme hoarding disorder, you know, in Adams, Jay, or even Allen County. And so I think what I'm going to do for you is connect you with Kylie. She's our system of care coordinator in Allen County, and she's able to communicate that to her system of care and say, hey, we have a client who's looking for this service, can you help? And it's really neat to see how that organization comes together. We're going to do an exercise here shortly that you'll be able to go see what your county page looks like. And this is a newer partnership, about a year young. And so we have some counties that are very engaged and active on LookUp, and then we have lots of counties that haven't really gotten there yet. So it's kind of a growing pains. I do want to point out that we want to remind users that we do have our awesome state resource, you know, 211, for resources that are kind of beyond your mental behavioral health needs. So, you know, LookUp traditionally isn't going to list things like food banks or clothing banks. They might list those on their county pages. They have a lot of flexibility in what they list in their system of care in county pages, but on the rest of LookUp in general, we wouldn't list those types of providers. And, you know, those are, you're able to connect to those through 211. And so at the bottom of each county page, you're able to click on that's 211, and it'll take you directly to their site. So did you know that LookUp posts mental and behavioral health training and events? And our analytics pages show that our events pages get actually a lot of traffic. And so this is the calendar for Allen County, and it actually shows all of the events on here that are considered statewide. We have a statewide events calendar, which I'll show you here shortly. And then each county has their own calendar where they can list their system of care events, anything mental behavioral health related going on, and really anything in their county that they want to list on their county page. Again, the system of care and my community pages have a lot of flexibility, even beyond mental behavioral health, of what they want to list for what's important for their community. Okay, so it's your turn again to practice this to make sure that it's working for you. You can go to LookUp, click on Communities, and explore your results, and then type in the comment section or the chat box if you have any questions or comments, and I'll walk you through, like I did the last time, on how to find A and B. But I'll give you a few minutes to try it on your own first. So Jessica found the toolkit for the opioid epidemic under Faith Community articles. Great job. That is the right answer. If I had you a gold star, I'm giving you a virtual gold star. Okay, 2 gold stars for Jessica. There's 11 bowling videos. I am so glad that you're navigating the site that easy. If you go to visit your county page under My Community and it's not populated, and there's a contact name for your system of care coordinator for that county, reach out to them and say, hey, populate LookUp. We would love to have this information. Okay, so we're going to move on. Just in the sake of time, I will pop over to the live site and show you where Jessica found that opioid epidemic toolkit for faith communities. So we go to communities. We're going to click on the faith community. We're in articles, and here is that toolkit. Under communities for students, we clicked on bullying topic and videos, and there are 11 videos. Rashonda wrote, I'm finding out some things going on in my community that I didn't even know was going on, and I'm pretty involved in the community. That's awesome news and bad news. Awesome news that now you know, and you know, if your community page is being populated, that's awesome. Spread the word. Sorry you didn't know, but glad that you know now. So again, you would get to that by communities, My Community. You would select your county from the drop-down or click on your county. And there's that events calendar for your county. Okay, moving right along. I mentioned briefly at the beginning of the webinar that last year we partnered with the Indiana Institute on Disability and Community, IU, and that LookUp is housing all the resources for the Indiana School Mental Health Initiative. And this page is actually populated and administered by the Institute by Dr. Kathy Pratt and Christy Gauss. And the whole idea behind this is, you know, what is the best place to improve the social, emotional, mental health of as many people as we possibly could? Well, the answer is our schools. And we know that stressed brains don't learn the same as brains that feel safe, that feel connection and can manage emotions. And so we want to make resilient school staff and students that would lead to resilient and thriving families and communities. So we're really excited about this partnership, and their page is amazing. So here are the topics they currently have listed. It includes everything from you know, bullying prevention in schools to educational neuroscience, and they have videos, articles, resources, and talking points on each of these topics. And so some of these look, you know, you've seen ADHD in 3 places now in our adult topics and our student topics, and now here in schools topics, but each one is going to be targeted kind of towards a different audience. So this is targeted towards educators, even parents, but mainly educators, people that work with youth. So here's our sample topic page. You know, again, it navigates the same as the rest of the site with your videos, articles. They have an extra section called resources and talking points. Okay, so we're moving right along the tab up here at the top. So we talked about find help, topics, communities, schools, and now here's another event calendar. So we just looked at your My Community event calendar for the events going on in your community. But let's say that your community calendar isn't really updated, or that you are just looking for things that are, you know, webinars, things you can access anywhere, or that are intended to kind of be for anyone, anywhere in the state. You'll just want to click on the statewide event tab for coming up events and be like, here's the webinar that you're in right now on the 22nd. And these are mainly, again, statewide events meant for everyone or webinars and things like that. And if you have an event like that that you want listed, we try to list we're on lots of mailing lists and all kinds of, we get our news from a lot of different places, but if you're not listed and you want to be and it's mental behavioral health related, let us know through the Contact Us tab or email me and we'll get you listed. Okay, so we have a blog. A lot of people have a blog, but we update it pretty frequently, usually at least once a week. You're going to find something new. And we have a couple different options there. A candid conversation, which is a casual chat with an expert in the field. Sometimes those are videos. Sometimes they're an actual article that somebody submitted. A message of hope is, that's all about sharing other people's stories. And we're receiving hope when people are sharing their testimony and what they've been through and how they've overcome. And then what's up is everything else, and typically it kind of announces like something recently that's happening in the news or new information. So if you want to kind of stay in the know and know like, hey, when is a new blog posted? Or when is that therapy section on topics going to be live? The best way to do that is to go to our contact tab, and you have a lot of options here. You can join our mailing list, and you could choose just to do the e-newsletter or to know when there's a new blog. We send those out every Monday morning, or messages of hope weekly, and that's something new that we are getting ready to launch. And here is where I believe it was maybe Jessica at the very beginning wanted to know, where do I request those crisis cards? And here's where you would do it. There's lots, when you actually, I'm going to pop over to the live site here in a minute and I'll walk you through it, because you're actually able to type in your address and how many you want and kind of give us all that information. And then over here under About Us, if you click that, you're going to see where you can actually download some LookUp brochures, posters. We can mail those things to you as well, but sometimes it's nice to have an electronic version. So when you click on that About Us over here is where you have those options to download a LookUp brochure, posters, or even to learn more about the Lutheran Foundation and download that mental health needs assessment and data compendium that we had talked about way back at the beginning, which was kind of the purpose for LookUp. So I know it seems kind of like a shameless plug to say, follow us on all of these social media accounts. But if I could ask you all a favor, and if you're on YouTube, could you subscribe to our YouTube channel? We're actually producing some unique videos. We did this Today's Drug series about a year ago, and we have these great videos, and we're limited in what we can do with them on YouTube until we have so many subscribers. So that's what I'm asking of you today, is subscribe to our YouTube channel and our other social media accounts as well. We haven't done a lot of advertising. We've done a lot of development with LookUp, not a lot of advertising for LookUp. So you could be our free advertisement, help us share this awesome resource with everybody and kind of get people in the know. So this is our last exercise, and looks like we're going to finish up a little bit early today, so that'll be great. I'm going to pop over to the live site before you kind of go through these exercises and actually show you on that Contact Us page how to request those crisis cards. Okay, so we were on the calendar for my community. Let's go over up here to Contact. And let's say you want to request these crisis cards. So when you click on that, after you've entered, of course, your name and your email, it says, please indicate the quantity you want and that they're available in increments of 25 or boxes of 700. And this brochures are increments of 25. And please include your mailing address. So when you do that and you submit it, that comes to me, and we will get those arranged to be mailed out to you. The same with those questions or comments, like let's say you can't find what you're looking for, or Cheryl, you wanted that information about the extreme hoarding disorder therapist, you know, we can try to connect you with somebody that has that information if we don't have that information. And if you clicked on About Us, we have a brochure and we have these awesome posters. I'm going to pull one up so that you can see how cool they are. These would be great for the back of bathroom stalls, to put in, you know, flyers. It kind of promotes the text to chat line, and they're really pretty as well. Rashonda, oh, what's the name of your YouTube channel again? Thank you for asking. Let's go to, if you're on LookUp, the easiest way to do it would be just to go to the bottom page. There's another way to join our LookUp mailing list, and go to the bottom to these social links and click on YouTube. And I think that's part of the problem, is that they will not, ooh, 2 people or 3 people have subscribed. Thank you guys. Is that I cannot get a unique YouTube name until I have so many subscribers. So it's this goofy long URL. So I can't even tell you the name, except that the best way to get there would be, again, to go to LookUp, scroll to the bottom, and then follow us by this icon down there. Hopefully that works for you, and thank you. Thank you for humoring me with that. Okay, so going back to the exercises that I was wanting you to explore before we call it a day. I'll come back to this exercise. Is, yeah, check out the events calendar and look for the details for something coming up that might interest you. So when you find an event, you can actually click on it, and it's going to give you all the information about that event. So it's usually pretty detailed. Sign up for our mailing list, follow us on social media. Thank you for that. Download our brochure. And yeah, check out the blog. I write on the blog frequently. It's kind of a passion hobby of mine. So check out one I did in February called What's Love Got to Do With It, which is all about how just being kind can increase your serotonin and your dopamine and make you feel happier, which is great for your mental health. Are there any questions, or take a couple moments to do that? Anything that you really love that you think is great? Anything that you think is terrible? All right, it looks like everybody is either busy exploring or kind of moving on. So I just like to give you this visual kind of to end with, to keep LookUp in your toolbox of resources. We all have toolboxes we use for various different things, and just to keep LookUp in your toolbox for, you know, all of your mental health needs as a starting point for yourself, for your loved ones, for the clients and people that you serve, to know that it's here. That the foundation is committed to investing in LookUp and making it a valuable resource for all of Indiana. And if you have questions or comments, you can always contact us. Here's my email, but again, you can reach me directly through that contact tab in LookUp as well. So if there aren't any other questions or comments, I thank you all for spending a little bit of your Friday morning with me. I hope that this was useful information to you. And thanks for thanks for watching. Joanna, I'll turn it over to you.
Great, thank you, Heather. Well, we want to thank Heather again, Lutheran Foundation and Heather again for their time. We thank you all for your time. Just a couple of reminders. We have the March 8th Collective Impact 5 Components Training webinar session. We will send out registration links to that, and also we'll send out a link to the course evaluation as well as the webinar video. And with that, we hope you have a great Friday and a great weekend. Thank you all.